Scan, check, eat. A smart app for diabetes patients to identify safe food options. Stakeholders, we have the nutritionists or the dietitians. They are the recommenders in this list. We have fitness centers as an extra, influencers, and we have the Food and Nutrition Research Institution as the investor, known for being at the USD grants and investing in these kinds of things. We have the Food and Drug Administration, decision maker to validate and the credibility of the application. We have food distributors, which could be in the saboteur category because not all food distributors would be as cooperative in the process or the actual information in creating the application. We have the people with health complications, which are the diabetic people, the end users. Next here is our stakeholder mapping. Not a lot going on, but to summarize, we manage closely the FNRI because they are the investors, and we have the nutritionists to manage closely too because they are the source, the one that adds credibility towards the information that would be displayed on the application. We have to keep satisfied the Food and Drug Administration, keep informed, of course, the diabetic patients, extra fitness centers, and just monitor the food distributors, like, yeah, the one stated, and the application store. Very simple. Next, we have the customer segment. We identified at least two, which is the physically ill individuals, diabetic people, and nutritionists. Now, for the interview questions for diabetic people, have you ever consulted a dietitian about your prescribed diet? Do you have experience having troubles determining if the food is safe for you or not? What are the implications of not being able to determine if the food you encounter is safe? We have the interview questions for the nutritionist. Have you ever been personally asked for a consultation by a diabetes patient? Like, did they personally come to the nutritionists without like any prior doctor or anything, like at their own will? Do you use a specific tool to present information to your patients, the app, or and what challenges do you usually face when educating diabetes patients? BCPC for the nutritionist. We have a digital tool that reinforces their advices. Easy food consumption tracker for both the nutritionist and the patient, and a digital tool that summarizes the patient's needs. Pains would be dishonest patients about their food intake, nutritionists possibly getting lesser consultations because they're already reliant on the application itself, and keeping up with the application updates. Now, the job to do is guide patients on how to use the app. If it's like 9 out of 10, like that is recommended type stuff. And we have the verifying if the contents of the app are factual, credible. Next, we have the diabetes patients. Gain is a digital tracker of daily, weekly, and or monthly food intake, an easy access health tracker application, just on the phone, easy access to medical consultations and healthcare informations, and pain would be potential information inaccuracy, over reliance on the application, and yeah, as the others suggest, lessons, professional consultations, heavily reliant on the app. Our job to do is avoid inputting incorrect information to retain accuracy that's solely based on the honesty or what the patient wants to add into the application. Set your own health goals and always consult a professional.